When you step into a professional recording studio, the very first thing that catches your eye is that massive soundboard.
Oh, yeah, just this giant desk of
Right.
buttons.
There are hundreds of knobs,
Yeah.
sliders, and these blinking lights everywhere. And if you reach out and push just one slider up, the bass suddenly booms through the whole room.
And then you pull it right back down, and the bass just completely vanishes.
It vanishes. And that feeling of total control, that direct, undeniable link between your action and the result, that is basically the holy grail of science.
Oh, absolutely. It is the ultimate framework for separating what we, merely suspect is true from what we can actually prove is true.
Exactly. And today, we are cracking open the engine of cause and effect.
Which really all comes down to mastering two foundational tools.
Yeah, so whether you are prepping for a TEAS or HESI nursing entrance exam right now, or you are just an insanely curious learner trying to figure out how researchers decode this very complicated world, this deep dive is for you.
We are getting into independent and dependent variables.
We are. And I want to start with the standard textbook definition, just to kind of get our bearings. So the independent variable, or 5E, is what the researcher deliberately changes or manipulates.
Right, it's that slider on the soundboard.
Exactly. And then the dependent variable, or DV, is the measured outcome. The volume that goes up or down as a result.
The reaction.
Right. But, okay, let's unpack this, because I know that simple definition hides a much, much bigger debate.
It really does. I mean, the friction point in modern science revolves almost entirely around that word, independent.
Wait, really? Just the word itself?
Yeah, because, in a true controlled experiment, say a clinical drug trial where a researcher randomly assigns patients to get a real medication or a sugar pill placebo, the independent variable genuinely lives up to its name.
Right.
The researcher sets its value completely uninfluenced by anything else in the biological system.
Because you are the one physically moving the slider.
Yeah.
Nothing else in the room is moving it for you.
Exactly. But the waters get extremely muddy when we look at correlational or observational research.
Okay, like what kind of research?
Think about massive studies in sociology, economics, or even epidemiology. Researchers in those fields frequently observe variables like a person's income, their sex, or their education level to, predict a health outcome.
Right.
And traditionally, for decades, they have called those factors independent variables.
Okay, let me play devil's advocate here for a second. If I'm observing, say, 100,000 people's diets and tracking their heart rates over 10 years, I have a massive, statistically significant data set.
Right, you have a lot of data.
So why can't I call diet my independent variable? I mean, I have the numbers to prove a connection.
Because you didn't touch the dial.
Yeah,
You just washed it. I mean, you cannot randomly assign someone to be 65 years old, just like you can't assign them to have a specific household income or a decades-long dietary habit.
That makes sense.
Those traits are already deeply entangled with, dozens of other factors in that person's life long before you started recording the data.
Which totally shatters a massive misconception I think a lot of us have. I always assumed the word independent meant that the variable was completely unrelated to anything else in the study. Like it just existed in a vacuum.
Oh, not at all. And that assumption leads to a major statistical headache known as multicollinearity.
Multicollinearity. That sounds intense.
It is. In observational research, these so-called independent variables are constantly tangled together.
How does that actually break the math, though? Like, what does that look like?
Well, let's use an analogy. Imagine you measure two things in elementary school students: their shoe size and their reading level.
Okay.
If you run the data, you will find they move together perfectly. Kids with bigger feet read at a much higher level.
But obviously, growing a larger foot doesn't teach a kid how to read.
Exactly. They are both being driven by a hidden third gear behind the soundboard, which is the child's age.
Oh, right. Older kids have bigger feet and they read better.
Right. That is multicollinearity. The variables are moving together, they're influencing each other.
So they aren't independent at all.
No. And because of this, regression-based fields and even the American Psychological Association's own style guidelines, they are aggressively nudging researchers to stop using the prestigious title of independent variable for these observed traits.
What are they supposed to use instead?
They prefer terms like predictor variable for the input and outcome variable for the result.
Saving the actual title of independent variable strictly for genuine, hands-on, experimental manipulation.
Exactly.
If the terminology is this flawed and heavily debated in the modern era, it really begs the question of where we got these words in the first place. Like, how did they become the gold standard for proving causality?
We actually have to leave the laboratory completely for that and go back to the 1700s.
Wait, really? 1700s?
Yeah, to the world of pure mathematics and calculus, mathematicians like Leibniz and later Leonhard Euler, who, by the way, formerly wrote the function y equals f of x in his 1748 work. Yeah, they needed a way to describe relationships between numbers. They needed language for the input variable x, which was chosen freely, hence independent.
Okay.
And they needed a word for the output variable y, which was determined strictly by x, making it dependent.
So we literally just borrowed math vocabulary wholesale.
Pretty much.
But an equation on a chalkboard is a long way from a clinical medical trial.
Right. And to bridge that gap, the concept had to filter through philosophy first.
Okay, tracking.
In 1843, the philosopher John Stuart Mill wrote a book called A System of Logic. He was actually responding to a skeptical argument made a century earlier by David Hume.
Ah, Hume.
Yeah, Hume had famously claimed that we never actually see true causality in the universe. We just see one event following another event. He called it constant conjunction.
Right, the classic philosophical puzzle, like the rooster crows and then the sun comes up.
Yes, exactly.
Did the rooster cause the sunrise? Hume says we can't be scientifically sure, we just see them happen sequentially day after day.
And Mill wanted a systematic, teachable method to break through that skepticism and actually isolate causes. So he proposed what he called the methods of agreement and difference.
Okay, what was his logic?
It was incredibly elegant. Mill argued that if you can hold absolutely everything in a situation constant except for one single factor.
Just one thing.
Right, and the outcome changes only when that one factor is introduced, you have hard evidence that the factor caused the outcome.
Wow. That is the exact blueprint of manipulating an independent variable while holding everything else constant.
It is.
But someone had to eventually put on a lab coat and test this on living things, right?
Yeah, the first physical applications emerged in the late 1800s. Wilhelm Wundt opened the first formal psychology lab in Germany in 1879, manipulating the timing of lights and measuring participants' reaction times.
Oh, interesting.
But the real modern statistical toolkit, the heavy machinery tested on exams today, that was built by Ronald A. Fisher between the 1920s and 1935.
I'm guessing he wasn't a psychologist.
No, he was a statistician working at a British agricultural research center.
Farming.
Fisher was deeply troubled by how unreliable farm field trials were. If you were testing a new fertilizer and one plot of wheat grew taller than another, you couldn't just claim the fertilizer caused it.
Because what if that specific patch of dirt happened to have richer soil?
Or slightly better drainage, or more sunlight.
You have 1,000 different hidden gears turning at once, which means you don't actually know if your fertilizer, your intended independent variable, is actually doing the work.
Exactly. So Fisher's brilliant solution was random assignment.
Okay.
Instead of planting all the fertilized wheat on the east side of the farm and the unfertilized wheat on the west side, he divided the field into dozens of tiny randomized blocks. Some got fertilizer, some didn't, distributed completely by chance.
Oh, that's smart. So by randomizing it, he mathematically guarantees that the good soil, the bad drainage, the extra sunlight, all of that is sprinkled evenly across both the fertilized and unfertilized groups.
Yes, exactly. The noise cancels itself out. Random assignment became the mathematical mechanism that lets researchers confidently isolate the independent variable from the chaos of the natural world.
This is such a wild lineage. We are basically using 18th century math vocabulary and 19th century philosophical arguments to run modern medical trials.
Pretty much, yeah.
So to see how Mill's logic and Fisher's math actually work in the real world, we need to look at how researchers put it to the test.
Right.
Let's start in the pristine, controlled environment of an early 1900s lab with Ivan Pavlov. The Russian physiologist, he noticed his laboratory dogs were salivating not just when they saw food, but the sound of the footsteps that reliably preceded the food.
It was a brilliant casual observation, much like Hume's rooster. But to prove causality systematically, Pavlov had to build an experiment.
Right, he had to isolate it.
Exactly. He paired a neutral stimulus, like a ticking metronome, with the presentation of food. Then later, he presented the sound completely alone.
So the independent variable, the thing he deliberately manipulated, was the presence or absence of that ticking sound.
Correct.
But, here is where a lot of students get tripped up on exams. I remember always mixing up which variable depends on which. Is there a fail-safe trick to keep them straight?
Oh, definitely. The trick is hidden in the name itself. The dependent variable always depends on the independent variable, never the reverse.
Okay.
So if you get stuck, ask yourself, which element is the researcher actively hoping to change, and which element are they measuring afterward? The one being measured is always dependent.
So in Pavlov's case, he was measuring the volume of saliva the dogs produced.
Exactly.
And he couldn't just say, the dog looks drooly. He actually surgically implanted a tube to measure the exact drops of fluid.
Yeah, and that brings up a crucial rule for all experimental design. You cannot study vague concepts. Methodologists require what we call operational definitions. Salivation had to be defined as measurable drops of fluid in a tube. If you can't pin a concept down to something tangible and measurable, it cannot function as a variable.
That makes total sense.
Yeah.
So Pavlov proves this works beautifully in a highly controlled, sterile lab. But you can't put 1.8 million children in a sterile room to test a vaccine. Which brings us to the Salk polio vaccine field trials in 1954.
Yeah, this was the largest public health experiment in U.S. history at the time. They called them the polio pioneers.
Wow.
It was a double-blind design. Some children received the actual vaccine, and others received an inactive placebo injection.
So the injection received is our independent variable.
Right?
But in a massive nationwide trial like that, how do you deal with the fact that these kids have different diets, different immune systems, and live in totally different environments?
Well, you apply Ronald Fisher's math, random assignment.
Oh, like the farm fields.
Exactly like the farm fields. By randomly assigning who got the real vaccine and who got the placebo, the researchers distributed all of those hidden environmental and biological confounds evenly across both groups.
So the noise cancels out.
Yes. And neither the families nor the evaluating physicians knew which version the child had received.
So the dependent variable, the measured outcome, was the rate of confirmed paralytic polio cases in each group.
Right. And when the results were announced, the vaccinated group showed an 80 to 90% drop in polio.
That is massive.
And because they used a truly manipulated independent variable with random assignment, they didn't just have to say vaccines correlate with less polio. They could definitively claim the vaccine caused the drop.
That kind of power is incredible for public health, but it can also reveal deeply unsettling truths when applied to human behavior.
Oh, definitely.
Like Stanley Milgram's obedience studies at Yale in 1961. Milgram wanted to know how far ordinary people would go to obey an authority figure who was explicitly instructing them to hurt someone else.
Yeah, the setup was intense. A participant who was acting as a teacher was told to give electric shocks to a learner in another room whenever they got a memory question wrong.
But the learner was actually an actor, right? And no real shocks were ever delivered.
Correct. The dependent variable, what Milgram was measuring, was the maximum shock voltage the participant was willing to administer, all the way up to a switch labeled 450 volts.
Which is terrifying.
Yeah, the operational definition of obedience was pushing that specific switch, and the independent variable here was the experimental condition itself.
How did they manipulate that?
Milgram systematically manipulated factors like the physical proximity between the teacher and the learner, or how close the authority figure in the lab coat was to the participant.
Here is a really surprising fact from the sources. In Milgram's baseline condition, 65% of the participants, 26 out of 40 ordinary people, obeyed all the way to the maximum of 450 volts, even as the actor in the next room screamed and eventually went totally silent.
It remains a chilling result. But methodologically, what matters is that when Milgram changed the independent variable, like putting the authority figure in a different room or forcing the participant to physically touch the learner, obedience rates dropped substantially.
Wow.
That specific manipulation proved that situational authority, not just like hidden individual sadism, was causing the behavior.
So that's what a successful IV and DV structure looks like when it's done right across animal biology, public health, and human psychology.
Yeah.
But we also have to talk about what happens when it goes wrong. What happens when researchers think they're manipulating a variable, but they've actually just stumbled into a correlation.
It can ruin an entire study. And in the world of medicine, mistaking a correlation for a true independent variable can literally cost lives.
The sources highlight a really striking example of this, actually, the hormone replacement therapy, or HRT, reversal.
Yes. For years, observational studies found that women taking a hormone replacement therapy after menopause had noticeably lower rates of heart disease than women who didn't take the hormones.
Right.
And based largely on this observed data, Millions of women were prescribed HRT.
But look at the structure. Nobody had randomly assigned those women to take hormones or a placebo, right?
Right.
It was correlation.
Exactly. The women who proactively chose to go to a doctor and take HRT tended to be wealthier, have better access to health care, and were just healthier to begin with. Those underlying factors are confounds.
This goes right back to the misconception that every predictor used in a study is a true independent variable. They treated HRT like a manipulated dial on a soundboard, when it was really just an observation tangled up with wealth and baseline health.
Right. And the fallout from that mistake was massive. In the 1990s, the Women's Health Initiative finally ran an actual randomized controlled trial.
A real experiment.
Yes, they manipulated HRT as a true independent variable using random assignment, and the results sent shockwaves through the medical community. They actually had to halt the estrogen-progestin arm of the trial early in 2002
Wait, why did they have to stop the trial?
because the data showed that women receiving the hormones had an increased risk of heart disease and breast cancer.
Oh my God.
The observational studies had it completely backward.
That is terrifying. It really highlights why researchers have to build a wall to keep extraneous variables out of their data.
Yes.
And they do that through control variables,
Yeah.
right? Which, let's clarify another massive misconception here. I've seen students assume that the dependent variable is whatever you hold constant during the experiment.
I see that confusion frequently, actually.
Really?
Yeah, but the thing you actively hold constant is the control variable. The dependent variable is exactly what you allow to vary and change in response to your manipulation.
Right. And if you fail to establish those controls, you end up with a methodological disaster, like the Stanford prison experiment in 1971. The sources bring up Philip Zimbardo's study as a massive cautionary tale.
Oh, absolutely. It is often cited in pop culture as this classic psychology study where college students role-played as guards and prisoners in a basement.
Right. Everyone's heard of it.
But methodologically, it is now widely taught as a total failure.
Because there was no genuinely manipulated independent variable.
Nor was there a control condition or random assignment to differing treatments. Worse, Zimbardo inserted himself into the study as the prison superintendent.
Which is wild to me.
Right. He became an active participant, contaminating the very conditions he was supposedly observing. We also know from later reporting that the guards were secretly coached to act cruelly rather than spontaneously inventing the behavior.
It's the perfect example of a study claiming the prestige of an IVDV experiment without actually having the structural integrity to back it up.
Exactly.
Which really forces us to look at the concepts of internal versus external validity.
Yeah, it's an essential distinction for evaluating any research.
How so?
Well, internal validity asks a very narrow question. Did the independent variable truly cause the change in the dependent variable within the strict confines of your specific study? Or did an extraneous confound sneak in and ruin the data? So the Stanford prison experiment has terrible internal validity because of the coaching and the lack of controls.
And the salt polio trials had incredible internal validity because the random assignment isolated the vaccine perfectly.
Exactly.
But what about external validity?
External validity asks a much broader question. Does this finding actually apply outside the laboratory?
Okay, like out in the real world.
Right. If an independent variable causes an effect in a highly controlled artificial room, will it still cause that same effect in the messy, chaotic real world?
You know, speaking of the messy real world, there's one more structural misconception we need to clear up before we look at how this applies to our daily lives.
Sure, what's that?
A lot of people think a study can only ever have one independent variable and one dependent variable. Like you can only turn one dial on the soundboard at a time.
Oh, right. That is a vast oversimplification of modern science. Researchers frequently use what are called factorial designs.
Factorial designs, okay.
Imagine a 2x2 grid. Let's say you are testing a new blood pressure medication. Dial number 1. Your first independent variable is the dosage, right? Say 10 milligrams versus 20 milligrams.
Yep.
But you also want to know if the time of day matters. So dial number 2. Your second independent variable is morning versus night.
Oh, so you turn both dials at once, giving you 4 distinct groups of patients.
Exactly. You are manipulating multiple independent variables simultaneously, and you don't have to just measure one outcome either.
You can have multiple dependent variables.
Yeah, you could track multiple dependent variables like measuring the patient's blood pressure while also asking them to report their energy levels on a scale of 1 to 10. The IV and the DV are really just conveniences of speech. Modern research is often an intricate dance of multiple variables.
And that brings us perfectly to why you should really care about all of this. Because understanding this framework is not just flashcard vocabulary for passing a nursing entrance exam.
Definitely not.
Though if you are taking one, this logic is the absolute backbone of evidence-based nursing practice. When you're evaluating a clinical trial to see if a new drug dosage is a true, randomly assigned independent variable or just an observed pattern, patient lives are literally on the line.
Just like we saw with the HRT trials.
Exactly.
And the importance extends far beyond medicine, too. I mean, it is quite literally how modern tech companies operate.
Really? How so?
Whenever an app or website runs an A/B test, they are using this exact framework. The independent variable is which version of a web page the algorithm happens to show you. The dependent variable is whether or not you click the buy button.
Oh, wow. Yeah. It's at the core of major economic debates, too. Like, does raising the minimum wage cause job losses? Well, the minimum wage is an independent variable that researchers can rarely manipulate directly across a whole country, which is exactly what makes proving causation in economics so incredibly difficult.
Right. It even applies to your everyday mundane reasoning. Well, say you decide to start drinking more water and suddenly you feel like you have more energy. Was it actually the water? Or did the weather change? Or did you also start sleeping more?
There's those hidden confounds again.
Exactly. Every single time you see a news headline confidently claiming that X causes Y, this framework gives you the power to judge if that claim has actually been earned through rigorous control or if it's just statistical noise.
Which leaves me with one final thought for you to chew on.
Yeah.
The entire scientific method, this beautiful engine of discovery we've been talking about, it relies entirely on cleanly isolating one independent variable while holding the rest of the universe constant. It was all about finding that one perfectly tuned slider on the soundboard.
Right.
But in our actual human lives, our health, our careers, our relationships, everything's happening all at once. So, if true undeniable causality requires perfect isolation, how much of what we experience every single day is actually just a massive web of hidden confounds we haven't even identified yet?
Yeah.